Hey, welcome to The Explainer. Today, we're going to tackle a really important health topic, alcohol dependence. We're going to break it all down using clear, straightforward information to help you understand what it is, how to spot it, and most importantly, where to find help. So here's the plan. We'll start by defining what alcohol dependence actually is. Then we'll get into the signs to look for, the very real health risks, and what I think is the most important part, right? The actual steps and support systems available for treatment and recovery.
Okay, so first things first, to really get a handle on this, we've got to be on the same page about what we're actually talking about. Getting the definitions right is key.
This is a question that comes up all the time. People tend to use the terms abuse and dependence like they're the same thing, but medically speaking, they mean very different things. So let's clear that up right now.
Okay, so here's the core distinction, and it's a big one. Think of alcohol abuse as being about a pattern of drinking that causes problems. Getting into trouble at work or driving when you shouldn't. But dependence, well, that's another level. That's when a person loses control and develops a physical and psychological need for alcohol. Right. So dependence, also known as alcoholism, is actually a health condition. It's not about willpower or just making bad choices anymore. It's a state where a person's body and brain have physically adapted to having alcohol to the point where they feel like they can't function normally without it.
So, okay, what does this actually look like in real life? Knowing the warning signs is so important, whether you're starting to feel worried about your own habits or maybe for someone you care about. You can really think of dependence as having these 4 core symptoms. It usually starts in the mind, with those really strong urges or cravings. Then it starts to affect behavior, finding it incredibly hard to stop or control. From there, the body adapts, needing more alcohol to get the same feeling. That's called tolerance. And finally, you get to actual physical dependence. And it's not just about the physical stuff. There are these other behaviors that can be huge red flags. Things like hiding drinking from others or seeing relationships get strained because of it. These actions are often signs that alcohol has become a serious issue that someone's trying to manage or conceal. And this is a really big one. When someone's body is physically dependent, it literally protests when you take the alcohol away. We're talking about withdrawal, feeling sick, getting the sweats, shakiness, serious anxiety. This is a massive signal that the body now relies on alcohol to feel normal, and it absolutely means medical help is needed to manage stopping safely. Okay, so why does recognizing these signs matter so much? Well, it's crucial because if alcohol dependence is left untreated, over the long term, it can cause serious damage to almost every part of the body. Yeah, we're talking about way more than just a hangover. This significantly increases the risk for major, life-changing conditions. Things like liver disease, heart problems. It can also really worsen mental health issues like anxiety and depression, and is even linked to several types of cancer. And the consequences just ripple outwards. The effects of alcohol dependence don't stop with the individual. They extend far beyond personal health, affecting the safety and well-being of family, friends, and the entire community.
All right, now we're getting to what I think is the most important part of this whole explainer. Because after hearing all that, it would be easy to feel a little hopeless. But the absolute key takeaway here is that there is effective treatment and support available. Let's look at that path forward.
So, where do you even start? Well, the very first step is to just talk to your doctor. I know that can feel like a huge, scary thing to do, but it is so vital. It's completely confidential, non-judgmental, and it's the best way to get a real assessment and find the right kind of help for you.
And treatment is not a one-size-fits-all kind of thing. The approach is really tailored to each person's specific needs. For some, counseling and making some lifestyle changes might be enough. For others with a stronger dependence, it might require a more structured approach with medical support like detox or rehab.
Now, for anyone who's just looking to cut back a little, whether there is a dependence issue or not, here are 4 really practical, actionable steps you could literally start using today. These strategies are all about being more mindful and making conscious choices.
And here is a message I really want to drive home. Nobody has to go through this alone. You are not alone. Let's take a look at some of the amazing organizations that are out there ready to help right now.
This number right here is an incredible resource. It's the National Alcohol and Other Drug Hotline. It's free to call, it's totally confidential, and they can give you advice and connect you with services right in your own area. It's a fantastic first call to make for anyone who needs it.
And what's so important to see here is that there's a whole network of support. It's not just for the person struggling with alcohol. There are dedicated services for mental health,
helplines for family members who are worried, and even support for CARES. It really recognizes that this affects everyone involved.
So let's end with this thought. Knowing all this information is great, but it's taking action that creates change. Whether it's for you or for someone you love, knowing that help is just a phone call away can make all the difference. Taking that first small step is always the most powerful one.